UBC, inspiring Uganda.
Qualified, professional, and compassionate doctors talking real solutions to real health problems.
This message is from the Ministry of Health with support from partners.
We welcome you to yet another highly informative episode of the DOCtalk show, proudly brought to you by Quiz Mali Productions and sponsored by the Ministry of Health and its partners. I am Dr. Muyanga and Dr, your host tonight on the journey into the world of medicine. And tonight in the house we have two visitors who are going to help us in dissecting the topic of tetanus. Dr. Phoebe and Dr. Meya, you are very welcome to the DOCtalk show.
Thank you.
I'm Dr. Phoebe Mbabazi, a physician in internal medicine at Mulago National Referral Hospital, working on the infectious disease unit.
Good evening, viewers. I'm Dr. David Meya, an infectious disease physician working on the same unit in infectious diseases in Mulago.
Our esteemed viewers, the topic tonight in the house is very interesting. In case you are out there and you know you have ever had something pierce your foot or pierce any part of your body, you have ever got a wound, then you are a candidate for tetanus, especially within the African context where we have dust all over the place. And therefore, we encourage you to sit back, get a hold of your pen, and take note of whatever our content experts tonight are going to share with us. Dr. Meya.
Yes.
Would you mind explaining to my father, seated somewhere in Bunyole, what tetanus is?
So tetanus is an infection caused by a bacterium, and it's the name of this bacteria is Clostridium tetani. That bacterium, as you rightly said, is found in soil, and we know that we have soil and dust all over the place. If, for instance, you're in a garden and you're digging, you're not wearing boots, and you accidentally, cut your toe, just damage part of your skin, that bacteria can essentially get into your body through that wound. And so sometimes I think you mentioned, if you've been pierced by something, even a nail, an old rusty nail, can also harbor that bacteria. And once it gets into the bloodstream, the bacteria then release what they call toxins or neurotoxins, which are really substances that go on to interfere with the function of the messaging from one nerve to another. Now, normally nerves, as they pass on and transmit impulses, will have to stop at a certain point. But so because of that neurotoxin getting to those junctions between one nerve and the next, they essentially cause the nerve to just keep passing on messages from one nerve ending to another. And so when we talk about some of the symptoms, that's what we will highlight.
Wow. Thank you so much, Dr. Meya. So from what you have said, essentially is I have muscles within my body, and these muscles, for them to be able to contract, they receive messages or impulses from nerves.
Right.
And it so happens that we don't just have one nerve, but they are connected or interconnected.
Correct.
It's a number of nerves. So in the context of tetanus, from what you have said, is that some of these nerves actually continue passing on messages despite the fact that within a natural setting, a nerve is supposed to pass on messages and probably stop.
Correct.
So for these ones, they continue passing on messages, and therefore the muscle, which is being controlled by that nerve, continues contracting.
Correct.
Dr. Phoebe, Dr. Meya has explained that very well to us. How would I know that someone has contracted tetanus? So what are the signs and symptoms of tetanus?
The nerves keep firing without stopping. So that is the mainstay of the presentation of what someone having tetanus will have. So usually the first sign will be maybe difficulty in swallowing because of contraction of those muscles in the throat. And then how the lockjaw, how tetanus comes to be called the lockjaw, the muscles around the mouth will also go into, they will contract, that kind of contraction, such that someone has difficulty opening the mouth. So when we have those, there are not so many diseases that will cause difficulty opening the mouth. So we should highly suspect tetanus. Later, as the disease progresses, someone will get what we call spasms. So okwesika in Uganda. So you start having those spasms, which are usually provoked by light, things like noise, by touch.
By spasms, are you meaning involuntary muscle contractions?
Yes.
Okay.
So you find that the muscles are contracting and someone is awake, they are but are unable to control that contraction. But what is key with tetanus is that these will be provoked by certain things such as touching, someone enters a brightly lit room, or when there's a lot of noise, then these spasms will go on. Along the way, as the disease progresses, someone may have fever, and then may also get complications that may come in, difficulty breathing, difficulty passing urine, difficulty swallowing, of course, which is usually, like we say, an early sign. So these are some of the common.
So our story started, we thought maybe it's a simple sore throat, having difficulty swallowing. Next, I'm having difficulty opening my mouth. It's as if my jaw is locked. And then you've talked about these unprovoked muscle spasms over time. Then you've talked about anything where a muscle is involved. That is, you talked about something to do with passing urine. You talked about respiration, which is still a process controlled by muscles. All these eventually will get affected. What population is at risk?
We've talked about the process of how you acquire the infection, and that sort of defines a huge part of our population, isn't it? So people who are involved in farming, particularly without protective footwear at all, people who are working in the metal fabrication industry, again, because you have dust, you have soil, and these are sometimes rusty, they're dealing with rusty metallic parts. And so if there's any accident where part of that metal breaches the skin, there's a possibility. We're talking about carpenters, and then high on that list, I'm not going to say, well, yeah, border riders. As long as you're involved in a road traffic accident. And unfortunately, we have, I think that's the group that tops the people who are at risk, who are always being admitted. So if you spend a lot of your time on a border and you're not protecting your head, you're not protecting your skin, in the event that you have this accident, there's contact with soil, it's possible that you can get that infection.
That awakens a memory. Most of us, I don't know if you did it, Dr. Meya, but personally, I played football barefooted. And there are times you will hit a stone so hard and either lose a nail or something. I believe that is we as well fall within that category because we would get wounds.
There's being at risk, and there's who is protected. I think we will talk about that. The other group I forgot to talk about maybe, but I think we don't see much of that these days, babies who have just been born. So there's what they call neonatal tetanus.
Dr. Meya, that's an important point. I don't want to cut you short, but allow us to go for a quick break, and we shall be right back and start from where you stopped. Thank you so much.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show. You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break. This is the DOCtalk show, proudly brought to you by Quizmali Productions. I would like to inform you that we are streaming live on YouTube. We also have a Twitter page on which you can send any question or query you have. As well, you can use the number that is displayed on the screen to call and send in any question you may be having. As you can see, we have a special guest who has been added onto the panel. Right next to me is Mr. O.P. Bosco. Mr. O.P. Bosco, you are welcome to the DOCtalk show. Yes, please. Mr. O.P. Bosco is a survivor of tetanus, that is contracted tetanus, but through the hard work of the medical team has managed to almost fully recover. Dr. Meya,
Yes.
Before I get an account from Mr. O.P. what happened, would you mind telling us something about neonatal tetanus? That's where we left off from.
Yes. So neonatal tetanus, as we were saying, particularly affects newborn babies. And part of the reason that happens is because during the process of birth, the way that the cord is treated, the umbilical cord that connects the mother to the baby is treated, especially the way it's cut. Partly that's where the disease,
I have remembered that culturally, we actually put cow dung.
So that's the reason that sometimes newborns will get tetanus. And remember, we talked about the origin of the bacteria in the beginning. So cow dung, I'm not sure why that they would do that, but that's
it's done.
Yeah, but I think it's now it's become much less. I'm not a pediatrician, but I'm sure now there's been better education of midwives, people who help mothers deliver, and there's also, I think, more vaccination for mothers during pregnancy. So the rates of neonatal tetanus have really come down.
Wonderful. Thank you so much. So if you have been in the habit of smearing cow dung on the umbilical cord of newborns, somehow by the grace of God, they have not got tetanus, please stop it, because the next one probably you smear on may be the one who goes down with it. In the house tonight, as I earlier said, we have Mr. O.P. Bosco, a survivor of tetanus, and he's going to share with us a brief account of what he went through. But we are going to switch to Luganda because he is more comfortable in that. However, the information is transcribed in English. Mukuru OP, tusanyusa okulaba.
Kyasamiranga obalabako.
Kati tubadde twagala okumanya era nsaba oyogereko n'abatulaba ki ekyatuukawo olyoka ofuna obuzibu obwakuleetera okufuna tetanus?
Kintu kyatandika ng'ekyokusaaga n'ate nga kyali serious nze saamanya nti kwolwo nali nti ndwadde ebbanga eryaddako kuba n'ebiwundu byasooka ne biwona.
Ebiwundu wabifuna otya?
Ekiwundu nakifuna naye kyava ku jjinja. Waliwo eyakanyuga ejjinja erinkwata wano. Okunkwata awo nengenda nze nenteekako obudagaladagala nendowooza mponye era n'ekiwundu ne kiwona. Ne wayita omwezi gumu wabula nzija mpita mu mbeera gye zitategeera.
Mbeera ki?
Embeera okuba nga ndi munafu nga nzija nafuwa mpola mpola. Kati akamwa ke kaatandikiriza nga nvudde mu bunafu ng'oluba luno oddugira lwegaayule sobole oteekayo ekyokulya nga buzibu.
Olulina engeri gye lukalambalamu.
Awo omwezi naatera ogumalako kati ekirwadde kitandise okugyayo sayini zaakyo. Olubuto luno ne lunkaluba nga lukaluba ng'ejjinja.
Okwata kungulu kuno?
Olubuto lukalubira ddala. Emimiro gino nenfuna obuzibu era nali sikyasobola kunywa na mazzi nga kyenyinza okunywa ge mata gokka.
Ate okulya emmere? Okulya
emmere gye nali nsobola okulya kagaati nga nkoza bukoza mu mata. Y'emmere gye nali nsobola okulya.
Nekyaddirira?
Ekyaddirira ne ŋŋendako awo famasi emu naye tebanyinyonnyola bulwadde butuufu bunnuma. Baŋŋamba typhoid bw'ate yannuma. Kati bampa eddagala lya typhoid
n'omira
nga ntandika omira empeke. Wayita ennaku bbiri ndaba tewali ki. Ndaba akamwa kongera kuziba. Bwe nalaba ekintu kisusse muzeeyi wange n'abiyingiramu n'aŋŋamba kiki ekikulu ne mugamba typhoid. Mu kumugamba typhoid ng'ate alaba sayinizi ddala nnyo tazitegeera nazitegeera. Nange nali sibimanyi wabula nkunnyonnyola ki kye nawulira neki kye nayitamu. Keekano muzeeyi wange nga nsitula nga tugenda e Mulago. Tutuuka abasawo twabasangawo bankeberakebera olubuto era nga lukaluba. Kati oluba luno nalwo ne balukebera ng'olulimi lwonna naluluma. Kumala okunkebera sayinizi ne badda ku musaayi era ne banyinyonnyola ekituufu nti Bosco n'obulwadde bwa tetanus naye nga nze nagenda manyi nabwa typhoid.
Bwe baakakutema nti olina obulwadde bwa tetanus walowooza ki muli?
Nalowooza ekintu kimu nzijukira ejjinja eryankubibwa nga lirondeddwa mwala lyaliko obukyafu naate nze nali simanyi nti nsobola okulwala olwakantuwe katyo. Kati olwatuuka e Mulago ne banteeka ku treatment.
Baakuwa ekitanda?
Ne bampa ekitanda ng'olwo ndi bulala maze ennaku 3 sirya. Luno oluba lukoze eki? Lwekutte kati terukyayasama ekyokulya tekikyagendayo ng'akantu kenyinza okuba ng'ateekayo mata gokka ate nga nagwo olugasaayo gaba ng'agagudde mu kamiro akato nga kuba mutyo konkoka. Munnaaye ne bampa ekitanda netandika eddagala lyange. Namalawo wiiki emu n'ekitundu abasawo ne bansiibula.
Mu wiiki eyo emu ekitundu oluba lwasumulukuka?
Oluba lwamala ne lusumulukuka lwa nsonga baali bampadde ekitanda netandika n'eddagala lyange.
Kati obadde okola ki? Olina eddagala lyonna ly'obadde okyaliko?
Sirina ddagala ddala lyonna nze nawonera ddala Ndi strong ekimala kati.
Obulamu butambula.
Ndabira ddala businga ne wali nga we bwali
basawo tubeebaza Dr. Phoebe and Dr. Meya, we thank you for the great work you have done.
Nange tantwala akakisa okubeebazaako abasawo b'e Mulago Hospital mwebale ekyamaanyi kye mwakola kuba nze nina ebiseera bye natuukamu nga ndi ku kitanda ne ŋŋamba naye naawona nze
ng'olaba ogenderera
nga ndaba ngenda naye ne baatuuka nga bansiibudde be nanyumizangako nga baŋŋamba kimu tetanus awona.
Twakola tumanyi nti omuntu w'ofuna tetanus oba ogenza olina kuwandiika kiraamo naye okukulabako okussaako amaaso ne tulaba nti oli mulamu kitegeeza nti si kituufu nti omuntu era waafuna obulwadde obwo yeetaaga kukola kintu kimu, genda mu ddwaliro eriri okumpi olabe abasawo balabe kye basobola okukola ki okukolera busobola okujja.
Kimu kye nasiima ku Mulago nti yo baŋŋamba ekirwadde ekikola ki
ekikulu
ekinnuma mu butuufu bwakyo naye gye nasookera eno ate nabo baaleetera okunyiga era we singa kaaba kaali kadde baali bakamaze okuba nga ate nvaawo.
Mukulu Bosco, weebale nnyo weebalire ddala olw'obugambo obwo bw'otuwadde naye tusuubira nti kati ate we wava e Mulago nti bakunnyonnyolamu n'ebintu ebimu by'olina okukola ki okuziyiza obulwadde buno obwa tetanus.
Ebintu bino just era bye tubeeramu mu mirimu kati osobola okwewala obutalavu bw'ekintu naddala ng'ofunye akantu akakusaza obutalavu bw'ekintu tekiba kirungi kukwata mu butalavu. N'ekirala obukyafu bwonna we buli bwewalire ddala oba butya oba butya tukubeere kukwata kuno kusobola okubeerako ku bacteria
anti kubaako enfuufu ate akawuka ako katambulira mu nfuufu eyo
naye nga ekiwundu bwe buzibu obusookera ddala.
Kati ekitegeeza nti abali eyo abali mu welding mwetaaga mukole ki titusseeko protective wear yaffe tuleme kwefuula mu byuma osala emitayimba okola ki nga totaddeeko protective wear. Mukulu Bosco tukwebaza olw'akaseera k'otuwadde. We thank you so much. We hope you have been following the account of Mr. Bosco, and certainly would still like to thank the team from Mulago Hospital for the great work they did in ensuring that Mr. Bosco continues living or thriving. Dr. Fifi, I would like to inquire from you, in just 1 minute, the signs you saw, is there anything else that could possibly have been done to zero in on the diagnosis of tetanus?
The diagnosis is mainly clinical, meaning it is recognized by a medical person who is aware of the disease. There is really no lab testing, like blood tests that we do to confirm that this is tetanus. I mean, the best would have been to grow, but it's rare that you will grow. You will take a blood sample and grow the bacteria in the lab. So most times what we use to make a diagnosis is how the patient presents.
Wow, we thank you so much. Thank you so much, Mr. Phoebe Bosco and the team. We shall be right back from this short commercial break we are taking. Thank you.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
I like to stay fresh. You wanna come preach and be my guest? Lighting. I did make a lighting up.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break. This is the DOCtalk show, proudly brought to you by Quiz Mali Productions and sponsored by the Ministry of Health and its partners. In case you have any question, please feel free to send them via the number displayed on the screen. However, they can also be sent via our Twitter page as well. And we are streaming live on YouTube. We left off with Mr. O.P. Bosco, who gave us an account of what he went through and how the disease progressed till he had to seek help at Mulago Hospital. However, during the short break, we actually had a discussion and the doctors raised something important. I have been informed that the closer the injury you have is to the head, Dr. Meya, please, you can elaborate a bit more on that.
Yeah. So there's what we call cephalic tetanus, which is essentially tetanus, but that results from injuries that are close to the head. I think because the source of all your nerve firing is basically from the brain, it's thought that that's where these toxins might concentrate and essentially give you problems. Dr. Phoebe talked about the problems with respiration, with those particular processes of our bodies that are not controlled voluntarily by us. So your heart rate, your temperature, your respiratory rate. Once the nerves that are responsible for controlling those things become involved, then you have problems.
Interesting. So if you are out there and thought that you can only get tetanus when you have a wound on your legs or on your hands, this is a wake-up call that if you get it on your head or anywhere close to the head, it actually is usually more serious. Let me put myself in the shoes of O.P. Bosco. I have come to you, you have looked at me, taken history and done all that. What next? How do you manage me in case you have found that I have tetanus, Dr. Phoebe?
There was literature that was reviewed about our tetanus in Uganda,
Yes.
and close to half of the people who had tetanus did not make it, died from it. So it's a very serious illness, and ideally the management should be in
Intensive care.
in an intensive care unit
unit,
or a high dependence unit where the patients can be closely monitored. So in management, what we do is so this toxin, that chemical that bacteria produces, once it binds to the nerves, that binding is irreversible. Okay, so what we do is to try and neutralize what has not bound. Okay, so you deal with that toxin that has not bound. Well, how do we do that? By giving antibiotics. So we use metronidazole, flagyl, which most people know. And then we also give the immunoglobulin, which is like the antibody that will help the body to fight against that tetanus toxin. And then the other management is around controlling the effects of that which has already bound to the nerves. So controlling the spasms. So there are some injections that we use, diazepam, chlorpromazine injections that are given. So Mr. P would tell you that he got injections every 3 hours.
Wow.
So either through a vein. We try to avoid a lot of injections in the muscle because these will trigger the spasms. They will make the patient get more of those spasms. So the other thing in management is to look for the wound. So sometimes these patients will come when they don't have a wound. But if there is a clear wound, then we look for it and clean it so that you remove any of the toxin that has not yet bound onto the nerves. And like I said, the patients are monitored for those complications, so their temperature, blood pressure, heart rate, all those need to be taken very regularly.
You know, Dr. Fifi, you talked about the wound. And I've actually just remembered that these tetanus bacteria, if I may put it that way, actually enjoy an anaerobic environment. So in case I have a wound that maybe has necrotic tissue or something, I get what you're saying, where we have to debride, remove all that necrotic tissue and all that. Okay, interesting. Yeah, please, you can.
But also just to note that, so Mr. OP, his wound had completely healed, right? So he had had the injury 4 weeks before. And so that's, if you've had an injury, a wound, yeah, you don't think you're completely safe. You need to make sure, and as we will discuss, there are other preventive methods as well.
Okay, interesting. Dr. Fifi, you attended on us managing the spasms. What other aspects of the management are we looking at?
So the supportive treatment is very important, the nursing care. So most times the patients cannot swallow. So we pass a tube, a feeding tube, in which food, should be passed as long as the patient still has the active spasms. So this, of course, in the hospital we have myths about these feeding tubes. Some people are like, I can't swallow, why are you passing the tube? So we always emphasize to the patients that anything can happen as they feed. One of the complications that kills the patients is if they are swallowing and then that food goes the wrong way. Okay, and because they get a spasm of those muscles in the throat. So we make sure, and tetanus as a disease uses a lot of, we would say, energy when you have muscles contracting. So feeding is very important. You need to have a high.
Dr. Meya used the statement of it's as if you are in a gym. You are working out full time, whether you want or don't want.
Correct.
We have appreciated that that bit about the management, where you're giving us antibiotics, you are giving me muscle relaxants, yes, antispasmodics, you are managing the nutritional bit. Maybe if I'm having difficulty breathing, you are intubating me, and all these other aspects. What complications can we possibly encounter within the context of tetanus infection?
So, we talked about those parts of, or those processes that run our lives, right? Like your heart beating, you being able to breathe in and out without effort, or even swallowing. You usually swallow without thinking about it, right? Now, once those particular processes or the nerves that control those particular processes become involved, then, your heart rate might just go way up, or your breathing might become compromised. And so you talked about people requiring intubation, so supported respiration. Sometimes what controls your temperature is also the nervous part of the nervous system that controls your temperature is also involved. And so your temperature might go sky high. So all those are processes that can, if they are not corrected, can easily lead to one's death.
Talked about the possibility of a hypothermia,
Yep.
hypo. Talked about BPs going up. We've talked about the respiration ceasing completely and all that.
Yeah.
That is interesting. Dr. Meya and Dr. Phoebe, we thank you so much for the knowledge you are sharing, and we are requesting that we have a short commercial break, and we shall be right back to explore some of the myths and probably demystify some of the beliefs out there concerning tetanus. Thank you. We shall be right back, but you can send in any questions you have via the phone contact displayed. We are streaming live on YouTube, and you can also send in your questions via our Twitter channel. Thank you so much.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
What is a dream? What does it mean to you? To her? To them? It's time we dare to dream anew. Dream bigger, better, bolder. Let's dare to dream of tomorrow, today, of someday, of the hope that comes with change, of a change that transforms lives. That glimmer in your eyes, the prospect of maybe, of all the hopes that we carry. It's the promise of enjoyments, co-enjoyments for you and your mates. A dream keeps us going. It's the one thing that drives us, inspires us, motivates us. One goal, one hope, one dream. With the Uganda National Lottery, your dream can become a reality. Bigger is here. What's your one thing?
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break. This is the DOCtalk show, proudly brought to you by Mali Productions. In case you have any question, please feel free to send in that question via the number displayed on the screen. It can also be sent in via our Twitter channel. We are streaming live as well, and you can still post your questions on our YouTube channel. The discussion this evening is on tetanus, and we have been talking about quite a number of things. Dr. Meya, recently I interacted with some lady. She had a big wound, and she had spent some good time with this wound. And her belief was that since she had taken a lot of time with the wound, tetanus was out of the question. She somehow had gained immunity to tetanus. I don't know whether that logic holds on your end.
Absolutely not. We talked about the risk of getting the infection is particularly because you have a break in your skin, right? And so having a wound, as long as that wound exists, as long as it's exposed accidentally to the bacteria, so any dirt, any dust that might have the spores of the organism, it's very possible that you might get the infection, particularly if you have never been immunized against the disease.
Dr. Phoebe, the other prevailing belief out there, and which actually Mr. O.P. Hinted about when he got the news that he had been diagnosed with tetanus, he thought that he was finished. So the belief out there is that when you have tetanus, you are what? You are finished. It is something you can't fight.
No, so that is not, it's not true. Like we have a live example of Mr. Bosco who recovered from tetanus. So it is possible for one to get tetanus and recover from it. Although, like we said, the chances of dying are also high. So that is where prevention really comes in. But we encourage people, if you feel, if you suspect, if you have any of the things that we've talked about, please go to a health facility because there is treatment available and there is a high probability as well of recovery.
One of the reasons why you should really seek help as soon. The issue is always how fast you come. Most of these diseases usually can be managed if you come in time. So in case you have any of the symptoms which were pointed out by our panelists as well as Mr. OP, please seek help from a facility, government facility, as fast as possible. We would like to know or to understand what possible measures we can put in place to prevent ourselves from actually acquiring tetanus. What measures can be put in?
So Mr. Bosco, talked about a few of the things. Just being able to take care of yourself and, you know, avoid injuries. I know that they're usually accidents, but as far as possible. But I think for me, the most important thing is immunization. We know that part of Uganda's immunization vaccination schedule includes tetanus immunization. And, you know, I think at 6 weeks, 10 weeks, and 14 weeks of birth, children will typically have the vaccine. And that will prevent the infection for at least 10 years. And then for girls, and this is where there's gender imbalance, I think, girls will most likely get another vaccine probably during pregnancy, a couple of them, 2 or 3 during pregnancy. But I think there's now some ongoing discussion around introducing an adolescent booster dose. So I think between the ages of 12 and 17 for everyone. That's not yet in practice. But I think it does not, you know, if you go to a health facility, as you said, and you've had an injury, as soon as you've had the injury, if you go to a facility and ask for the tetanus vaccine, you should receive it.
Free of charge.
Free of charge. And that will, of course, it's not free of charge, but somebody's paying for it. The government is paying for it for you. But you should be able to get the tetanus vaccine. And I think that's in terms of prevention, I think that's really the most important. We've seen countries where tetanus was last seen in the late 19th century. But because they created the demand for the vaccine, and they also, as the government is trying to do, made sure that people get the vaccines when they should get them. Yeah.
So, Dr. Meya, you've talked about vaccination. You've talked about us avoiding getting injuries. Yes, the accidents, but the injuries you can certainly avoid. Yeah. How? We are thinking of using protective, where that if I am a border rider, put on your what? Put on your helmet, put on your protective wear. If I am welding, please do not assume that you are Superman. Please put on your protective gloves and any other protective wear you may need. But it doesn't boil down to us protecting ourselves as well. Take care of the people around you. Mr. Bosco got stoned. So, yes. So he didn't seek the injury, it sought him. So probably we can also think about those measures as well. So in case I have the signs and I'm having difficulty swallowing, I'm starting to feel my jaw stiffening, and any of the other signs and symptoms you have elaborated ably, where can I seek help?
All health facilities, ideally. Perhaps from, if we're talking about the government facilities, I think from Health Center 3 should be able to manage, at least initially. So for instance, getting that first tetanus toxoid shot, and then if they can't really manage you, then being able to refer you to a higher health facility. But I think as Dr. Mbabazi pointed out, as the disease progresses, of course you won't keep somebody at a health center for. You need to move them to a tertiary level care facility where they can manage some of the complications we touched on.
Thank you so much, Dr. Meya and Dr. Phoebe. We are drawing towards the close of our discussion, and I would like to get some parting shots from each one of you. And I think it's time to start with Dr. Phoebe.
We hope that more effort will be put into vaccination to prevent tetanus, especially targeting the high-risk people, people that are at risk of getting these wounds. Because we said all wounds are a risk of tetanus. So people like border riders, miners, welders, and then already we have enough coverage for the pregnant women. So one, tetanus is preventable, and the key thing in prevention is vaccination or immunization, and then it is manageable. So if anyone gets the signs, please go to a health facility as soon as possible.
Well, thank you so much, Dr. Mbabazi, Dr. Meya. Some parting shots from you.
Yeah, so for me, I think there's two key things. One, just to follow up on what Dr. Mbabazi was saying, I think as a country, we need to come up with some practical solutions. We know that we have so many people at risk especially because they are border riders. And human behavior is one thing to change, that need to put on helmets. I know you've emphasized people should protect themselves, but it's, that human behavior is hard to change. But so we do know that if you give those individuals a tetanus shot, it would at least cover them for 10 years. And so I think being practical about, can we come up with a program where at each border stage, right, those who would like to have the vaccine are essentially offered the vaccine. I think it will save a lot of lives. It will also save the country a lot of money, because the numbers we talked about, 400 patients, 500 patients a year, either in Mulago or Chirudu. I mean, that's a lot of patients, particularly if 50% of them are dying. It means you're losing 200, mostly men, in their young, productive years, right? So we have to be practical about some of these things. I think the other area is, Dr. Mbabazi said 50%, almost 50% of people, do not survive. We need to invest in research to come up with better interventions. Some of those things are really around making sure that if you have tetanus, you're able to go to an ICU. So just expanding the capacity for some of these facilities, I think, is something that would also be very helpful.
Wow. Dr. Mbabazi and Dr. Meya, I would like to thank you so much for the time you have given us. And certainly I would like to thank our esteemed viewers for the time you have given us and for the questions you have sent in, the interest you have showed in this discussion. We would like you to stay interested. Are you a border rider? Are you working in welding? Are you working in mining? Generally, are you a human being that is at risk of getting an injury? Please interest yourself in getting vaccinated. If you have not been vaccinated or dodged it, consider the possibility of getting a tetanus shot if you have not got one before, or maybe when you have got an injury, as well as consider protecting yourself at all times. That is, use protective wear in the work you are doing if it puts you at the risk of getting these injuries. We thank you so much for the time you have given us. Please stay interested in issues pertaining to your health. Your health is a huge priority. We thank you so much for the time you have given us. This has been the DOCtalk Show. Thank you.
This message is from the Ministry of Health with support from partners.
UBC, inspiring Uganda.
The Uganda Film Festival 2024 nominees for Best Indigenous Film: Omukululo, Maria, The Lions of Buganda, Makula, and Half-Life.
National Heroes Day of Uganda takes place on 9th June every year to commemorate the brave people who laid down their lives during the Ugandan Bush War that took place between 1981 and 1986. This year, the 35th Heroes Day will be commemorated under the theme Hail our heroes. A secure Uganda is now reality. On Sunday, 9th June 2024, all roads will lead to Mpenja Church of Uganda Primary School Playgrounds, Mpenja Sub-County in Gomba District. Join us to witness heroes from different parts of the country receive medals to recognize their contributions to the betterment of Uganda from His Excellency Yoweri Kaguta Museveni, who will be the chief guest on National Heroes Day. All this will be broadcast live on your national broadcaster, UBC, inspiring Uganda.
Buli munya-Uganda nayetenga amakuru marungi. UBC West erina amakuru marungi kandi agali kwesigwa. Leero za program zaayo ziri omu Lunyakitara hamwe n'Olufumbira. UBC West erina tekinologiya ey'omulembe eri kugibaasisa kuhika omu bicweka byona omu ihanga nangu n'aheeru y'eihanga. Tukwatire aha frequencies ezi: Kisoro 97.7 Fama, Kabale 93.7 Fama, Hoima 99.1 Fama, Kampala 5.7 Fama, Mbarara 97.4 Fama, Futpoto 98.8 Fama, Masindi 5 Fama. Kurikiriza UBC West ohulire embaganiza. UBC West empika huna.
107.3 Kampala, 96.9 Mbale, 95.7 Jinja, 98.6 Soroti. You are all covered.
UBC Butevo. UBC Butevo.
One-on-one with Michael Jordan Lukomwa.
A weekly face-to-face conversation focusing on accountability, inspiration, information, and sensitization of the public from the various sources, such as inspirational profiles.
Having a disability is not inability.
Professional guidance.
There is no special antiretroviral therapy that is given specifically for discordant couples.
And of course, politics.
Don't you see anywhere that you would give a credit in the fight against COVID?
My role as the owner of the country is not to, be preoccupied by giving credit to my servant.
We have said that if we are to talk to General Museveni, there must be certain conditions in place.
Is it true that you paid 5 million shillings to MPs that voted for Anita Mong and Tayebo?
That is laughable. Why would we pay when we have nominated them as SEC?
Every party has been represented in Uganda's parliament for 10 years. We only
by one MP, you yourself.
And my daughter, Susan.
Every Friday 9 p.m. it's one-on-one with Michael Jordan Lukomwa on UBC TV, inspiring Uganda.
Program My School, a great students program and your answer to education perspective, giving you reason as to why you should pay school fees for a child's education with items like students' talents, thoughts, adventures, and skill showcased, leadership skills, and all other activities plus concerns in various schools in your locations. Remember that our children are our future generation. Don't miss Program My School.
UBC, inspiring Uganda.